instrumental in getting this great program put together for us. And what I would love to do at this point is welcome, I believe, Robert from the RAZ Mobility team to the stage, and we can get to know him a little bit better. And hold on, I just gotta uh, stop share. There we go. Robert, there you are.
Hi, Steve. Good to see you.
Great seeing you. Great to be doing another one of these with you and your team at RAZ Mobility. And for those that may be on this call that are not familiar with RAZ Mobility, tell us a little bit about yourself and your organization and what you do.
Thank you, Steve. Hello, everyone. For those who don't know me, and that's most of you at this point, I'm Robert Felgar, one of the owners of RAZ Mobility. Also here is Norman Selimich, my partner. Thank you for joining this webinar. It's the second webinar that we have in our series on aging, and our objective is to bring you a webinar every month or two. So look out in your emails for additional information on future webinars. Most of you are customers of RAZ Mobility and are familiar with the RAZ Memory cell phone, but some of you are not. So for those who are not, the RAZ Memory cell phone is for seniors, primarily for seniors with cognitive decline. Most have dementia, as well as some have other disabilities, or perhaps a senior just wants a solution that's very simple. And if you want to learn more about the solution, again, for those who aren't familiar with our phone, you can go to razmobility.com. Thank you for joining again. Thank you for joining the webinar, and enjoy. Steve, back to you.
I love it. Well, don't get off the stage yet because I want you to your help in us welcoming our program today, which is um, really going to be a great one. We've got Dr. Katie Starr and Eric Levitan. They are with Vivo. I hope I pronounced it correctly. Eric and Katie, uh, super charged up to have you here today and learn from you on how we can use exercise strategies for healthy aging. And I know a lot of the RAZ Mobility customers are interested in how somebody with dementia or cognitive impairment might use exercise. Um, um, great to see y'all. Before we dive into your discussion, and I know you've got a PowerPoint, let's get to know you a little bit better. Tell us a little bit about your backgrounds and what got you into this.
I'm thrilled to have been introduced to Dr. Katie Starr, who is really the brains behind all of this, and I'll let her introduce herself. But when I first, as an entrepreneur, I've been fortunate to have started a few companies, and as I was pursuing what I wanted to do next in my life, I became a remote caregiver to my aging parents. And I had a father who lives in Philadelphia and a mom who lives in Florida, and I live in Atlanta, Georgia. And it's hard to be a caregiver. It's really hard to be a remote caregiver, and navigating all of that. And as a part of that process, I learned a lot about aging. I learned a lot about cognitive decline, and I learned a lot about physical decline. And I was actually introduced to a word. I don't want to get too far ahead of ourselves in our presentation. I was introduced to the word sarcopenia, which we'll talk about shortly.
Never
What
heard it.
what is that? Sounds like it's an island off the coast of Italy. It is not, and it's something that we all should know about. And the fact that I'd never heard that word before and did not really understand the breadth, the magnitude of what this issue is, really set me on a path that I wanted to help older adults be able to build strength and maintain their quality of life, maintain their function, their independence as they age, doing this for my own parents. And then I was fortunate enough to meet Dr. Katie Starr, who is a professor at the Duke University School of Medicine, who studies this for a living. And I'll let you take it from here, Katie.
Yeah, no, thank you so much. So, a similar story in regards to how I really got interested in thinking about aging and exercise and nutrition. So, my mom actually taught line dancing to older adults when I was a kid. And I would go and watch her do this. And it really was something that laid the foundation for me on not only the importance of movement, but also how powerful that is in an environment where you have other individuals who are like you doing exercises, the laughter, the camaraderie. So really that led me into going into a background in exercise science. I had the wonderful privilege of being able to work at the Cooper Aerobics Center in Dallas, Texas as well, which is under the tutelage of Dr. Kenneth Cooper, who is the father of aerobics. And then from there, I moved on to getting my master's and PhD in nutrition and aging. And so my work has really been focused on the intersection of nutrition and exercise and how we can use these lifestyle interventions to not only improve muscle and function, but really that health span, improving our years of longevity and the quality of those years. So just so excited to be here today.
I love it. Now, before we hand this off, I want to share with folks. We had a little, usually before these discussions, we have a little pre-meeting, and Eric and Katie are with a company called Vivo. You'll learn a little bit about that, but I want to. I was like, hey guys, can I try it? And they set me up so I could join one of their classes, and I did it this morning, okay, at 9 o'clock. And the good news is, if you can see my screen, my daughter snapped this shot of me, but this was very cool. I commend you all on this platform. But what you see here is I am doing a back, a bent over back row. I've got weights in my hand, and this is the workout that we did. And when I say we, if you see on the screen here, Eric is our instructor, and he corrected me on my form several times throughout the 45 minutes we were together. But these are all other people. We're all exercising together. I honestly, I'm a member of a gym where they have classes like this, and I truly saw no difference between being in a gym and exercising like that in my basement, and much different than like sticking a video in your or turning on some video where that's pre-recorded. This was very interactive, and I'll tell you, the coolest thing that you guys are doing, talking about cognitive health, at the beginning they blend exercises and memory together, and that was just a great way for me to wake up this morning, get my brain and my body working together. Commend you on the platform. And folks, there's down on the bottom of your screen, there's a little resources button that you click. If you click on that, they have offered a free month for anybody that's interested on this call to try it out. So I recommend that, actually. Yeah. So anyways, good job, and really interested in learning more about that Greek island that you're going to talk about here. So we'll let you guys share your screen, and then myself, Robert, and Nerman will dive backstage, and you guys just shout out our names if you need us.
Sounds great. Sounds great. Well, thank you much. Thank you so much, Steve, and I appreciate all of the kind words about your experience this morning. And it really is such a critical thing that we are talking about today, because at the end of the day, we all know we should be exercising, right? There's nothing new about that. But a lot of us don't necessarily understand the science behind what is happening to our bodies, and specifically our muscle mass and our strength as we age. And as we experience this decline, we all sort of accept it and feel like it's an inevitable part of aging. And what Dr. Starr and I are so excited to talk about today is there's actually something we can do about this, and focusing on challenging our muscles on a regular basis, also known as strength training, is a wonderful way to maintain our quality of life, to maintain our health, to maintain our independence, and it's attainable. It's something that you can do even when it doesn't necessarily feel like it is. And so it is my privilege to introduce Dr. Katie Starr, who is really going to start off by talking about doing a deeper dive around the science of what happens to our bodies as we age and the fact that there is something we can do about it. And then I'm going to jump back in and talk about how you can incorporate this into your own life. What does it mean to create those habits, that accountability, do it safely, and really thinking about how to take lessons from this presentation and build them into your own routine. And so with that, I'm going to turn it over to Katie.
Thank you so much, Eric. And it is such an honor and privilege to be here today to talk about really the science behind strength training and how it impacts our lives, and the things that we can actually do to help combat that loss of muscle mass that occurs with aging. So I'm going to dive right on in and really start out by stating the obvious. We know that as we get older, the things that we used to love to do are harder. The things that we did on a daily basis may feel a little harder, like getting down and up off the floor or walking upstairs. And this is not uncommon. This happens, and we're going to talk about why this actually happens. But what we really want to talk about and understand is that if we stop doing these activities, we are going to see an even greater decline. So we like to talk about that adage, use it or lose it. So even though it may be challenging, even though we know getting down and up the floor, off the floor might be more difficult, what we want to make sure that we're doing is we're still doing those activities. We're still doing that, because the less and less that we do of that, the more decline that we're going to start to see and the loss of that function that we're going to really see. So let's start talking about really the science and the foundation that really goes hand in hand with that term that Eric used, which is sarcopenia. So what we know is that as we get older, we start to see this progressive loss of muscle mass. Interestingly enough, our muscle mass actually starts to peak at about the age of 30 to 40. And from there, we'll start to see a decline. We see up to about an 8% loss of muscle mass per decade after the age of 40. Now, that actually accelerates to up to 15% after the age of 70. Now, there's a caveat here. What we know is that if we have chronic health conditions or levels of inflammation, we are going to see an even higher acceleration. So an accelerated rate even greater than that 15%. So that's really important as we're talking about ways in which we can reduce or slow down that loss of lean muscle mass. We have to keep in mind how we can also start to prevent or really focus on those health conditions that we may have or we are on our way to having. What I also have here is a cross-sectional area of the thigh, and this is of the thigh of a younger individual and an older individual. The reason I love to show this image is because I can stay here, I could sit here and say, hey, we lose muscle mass, but it's so much more impactful when you can actually see that difference of a younger individual and an older individual. So what I want to highlight here is not only do we see a smaller muscle in that 70-year-old individual, what we also see is more fat, that white that's infiltrating that muscle. So if you look at the 20-year-old muscle, there's not a lot of white in that muscle. However, when we move to the 70-year-old muscle, what we see is this expansion of fat, that white infiltration. Why is that a problem? Well, that is a problem because of the way our muscle contracts and releases to generate force and power. That allows us to do the activities that we love. It also it prevents us from falling or being able to catch ourselves. When we have fat infiltrating that muscle, the muscle's unable to work properly. And so again, that's when we start to see that those activities that we love to do become more and more challenging. So that's really important. So let's talk about sarcopenia. So sarcopenia is not only the loss of muscle mass, so we see that with aging, but it's also the combination of loss of muscle strength. So what we know is that after the age of 50, we see up to 10 to 15% loss of muscle strength per decade. So that's really that's really important as well, because of the fact that when we combine both that loss of muscle mass with that loss of strength, what we are going to see is a loss of function. And that is sarcopenia. So really this characterization of those three components. I always also like to emphasize the fact that we have two different types of sarcopenia. We have primary sarcopenia, which is seen with age. So naturally occurring as we get older, we see these conditions happen. And then we have secondary sarcopenia. And secondary sarcopenia is the result of chronic health conditions like cancer, like diabetes. That is, again, having a larger amount of inflammation circulating in the body that's going to accelerate that loss of muscle mass, muscle strength, and ultimately leading to that decline in physical function. Now, I know that sounds like doom and gloom. So let's actually get excited, because there is absolutely something you can do about it. And that is why we are so excited to be here today to talk about that. There is a vast amount of evidence that shows that no matter what your age is or the functional status that you're coming from, or even thinking about our cognitive status, strength training can help reverse some of these age-related losses of muscle mass. It can help build bone. We can also see restoration of strength and functional abilities, and we also see improvements in cognition. And that is so exciting, and that's what we are really excited to be talking about today, because again, there are absolutely things that we can do to slow down that process. So how do we actually combat sarcopenia? Well, what we're going to talk about today are really two components of combating sarcopenia. The first is going to be exercise. Now, absolutely, cardiovascular health is very important, and we should be doing and following the physical activity guidelines of meeting 150 minutes of moderate physical activity or 75 minutes of vigorous activity per week. That is something we need to say. But what we also need to be doing is meeting the physical activity guidelines of strength training at least twice a week. Why is strength training so important? Well, strength training is so important because it actually stimulates muscle protein synthesis. What is muscle protein synthesis? Muscle protein synthesis is our ability to actually build muscle. So we actually have the ability to actually build our muscle up. When we do a resistance training, what actually happens is we break down the muscle, and then the muscle repairs itself even stronger. We also see that reduction of that intermuscular adipose tissue, which is something that we really want to be improving as we get older, because again, that's going to help with our functionality. So strength training, very important for us to stimulate muscle protein synthesis. Nutrition also plays a big role in this, particularly around protein. Our essential amino acids, and essential amino acids are the amino acids we actually have to get from food. Our body does not actually make those. We find those in our protein sources, particularly our complete proteins that have all of those essential amino acids. So that could be plant-based or animal-based. But what we know is leucine really is that driver, is one of the essential amino acids that drives muscle protein synthesis. So when we consume adequate amount of protein, we're actually able to stimulate muscle protein synthesis. So when we combine both the resistance training or strength training with our protein, we're going to really maximize that ability to slow down that progression of sarcopenia. So let's talk about that nutrition component. So what we have here is a graph that really demonstrates how we typically eat protein. What we see is that we usually have a small amount of protein for breakfast, a little bit more protein for lunch, and then most of our protein comes from our evening meal. Now, this is an illustration of around 90 grams of protein. What we understand from the research is that there is a certain amount of protein that we actually have to consume to stimulate muscle protein synthesis, or again, build muscle. And what the research shows is it is around 30 grams of protein that actually starts to trigger that muscle protein synthesis, or about 2.5 grams of leucine. So what you can see here is when we consume protein in this skewed fashion, it means we're only really hitting that that threshold one time. So we're not maximizing the amount of time our body can actually stimulate muscle protein synthesis or build muscle. However, if we start to think about consuming protein more in a repeated stimulus, where we actually consume adequate protein for breakfast, for lunch, and for dinner, this allows us to hit those thresholds multiple times throughout the day to really be able to stimulate that muscle protein synthesis. Now, the question I always get asked is, what does 30 grams of protein look like? How do we actually get 30 grams of protein? Well, it's actually not that challenging. It may sound like a lot, but really it's not. 30 grams of protein are around 3 to 4 ounces of our poultry, our meats, our fish. So again, not as challenging as we think. It can be a cup of Greek yogurt. So Greek yogurt is going to have a higher concentration of protein in it, or even thinking about a breakfast burrito. So there is absolutely, we can absolutely do this, but we just have to be a little bit more intentional of how we're thinking about that protein so that, again, we can maximize the number of times that we're stimulating our muscle protein synthesis. So I'm going to move away from the nutrition component, and let's really talk about and dive into strength training and really the research that shows benefits of strength training. So anytime I'm working with patients or my participants, what I always like to ask them is, hey, what does strength training mean to you? Or when you think about strength training, what is it that you envision? And this is the image that I often get described to me. Have to be in pain. I have to be in a gym setting. I need to lift heavy weights. I am going to bulk up. What I want us to do is I really want us to take that image and I want us to throw that image out the window. So yes, of course, that is strength training, but that is not the strength and resistance training that we are talking about today. What we are really talking about is utilizing our own body weight, utilizing resistance bands, utilizing dumbbells to actually do movement patterns that mimic our daily activities. So what I'm talking about here is being able to push ourselves off of something, being able to get ourselves up and down off of the couch or off the toilet, being able to get up and down off the ground. These three images are movement patterns that we do on a daily basis. And by being able to continuously doing these, we're not only going to be using it, we're also not going to be losing it. And that is so powerful because this type of resistance and strength training has similar exact benefits of going into a just as very important base. So we can add resistance bands and dumbbells to it to accelerate the amount of weight that we're actually utilizing to be able to continuously meet intensity, challenge our muscles, and stimulate that muscle protein synthesis. So my favorite part of this lecture is talking about the benefits of strength training. So this is where I really love to dive into the numerous benefits that we actually have. And this is just a small list of the benefits of strength training that we know of regarding our health. So the first one is obviously the one that makes the most sense, right? Of course, when we do strength training, we would expect to see enhanced strength and function. So the study that I have here is really looking at women 65 and older who had not participated in strength training prior to doing 12 weeks of strength training twice a week. And what this study shows is that in that little amount of time, there were significant improvements in upper body strength and lower body strength, around 25%. So a fourth stronger than they were when they started out in just 12 weeks. The second study is looking at the impact of strength training on sleep. We all treasure our sleep. We love our sleep. Our sleep is so important. Why is sleep so important? Because sleep is so important because it is our body's ability to actually regenerate. It's our body's ability to be able to heal, our body's ability to actually be able to respond to the next day. So knowing that something can actually help us sleep better and have better quality sleep is really key. So this study actually looked at the impact of strength training over a 12-week period of time, strength training twice a week, and showed that individuals who did participate in strength training showed improvements not only in sleeping longer, having less interrupted sleep, but the quality of sleep, that ability to actually get into REM sleep, deep sleep, light sleep, that cycle of sleep that really does allow for that restorative process that we need for our bodies actually was hit. And so again, another wonderful area and key area of strength training, and something that we oftentimes are not really equating to strength training. Increased longevity. This is a large epidemiological study. So a study that followed people over a long period of time and looked at the impact of individuals who actually did strength training twice a week compared to those individuals who did not do strength training, and what actually happens to not only longevity, but also health conditions. And what the evidence showed on this one is that individuals who participated in at least 2 weeks per week had a 46% lower odds of death from all causes during that study period, and a 41% lower risk of cardiac death, and a 19% lower odds of dying from cancer. So that is really, really impactful, right? Doing strength training twice a week not only improves strength, not only improves sleep, but also we're seeing these improvements in longevity and reduction in cardiovascular disease, cancer. So again, another wonderful example of how doing something twice a week can have these long-term impacts. The area that I really love talking about, and this is an area of research that I spend a lot of time in, is around surgery. So what we do know is that about a third of all older adults undergo an elective surgical procedure. However, those individuals oftentimes have poor outcomes, have longer lengths of stay, and also take longer to return back to their baseline function. So there has been a body of work that has really looked at how we can actually optimize our older individuals who are undergoing elective surgery so we can reduce these sequelae of outcomes that occur with the surgical insult that happens. What we found is that by doing resistance training for at least 6 weeks before surgery, we can actually significantly reduce length of stay. We can reduce the risk of postoperative complications, and we can improve our ability to get back to our baseline function at a much faster rate. That is really, really impactful. And again, thinking about just 6 weeks yields these large benefits. So again, if you're having surgery or thinking about having surgery, strength training is something you definitely want to be considering adding into your preoperative regimen so that you can have the best outcomes. Reduced risk of falls is another very important area. We know how detrimental falling hip fractures are and our risk for death following hip fractures. So we obviously want to do everything we can to reduce our risk for falling. What the evidence shows is by doing strength training at least twice a week, we have a significant reduction in that reduced risk of falls. The other very valuable impact that strength training has around falls is reducing our risk or reducing our fear of falling. So what we know is that when we have a fear of falling, we start to reduce our life space, or we start to reduce doing the activities that we love doing. Why is that impactful? Well, that's impactful because, again, coming back to that use it or lose it. When we stop doing things that we love, when we stop going and doing the activities that we used to do, our function is going to decline. We're going to see that decline in muscle mass. We're going to see that decline in strength. So by improving or reducing that fear, we're actually expanding that life space. And again, that ultimately shows significant benefits in our ability to continue doing the things that we love. Now, around caregiving, and this is, again, another very exciting area that we are really excited to be talking about. We know that caregivers often do not focus on self-care, and we know the reason why. They are exhausted. There's a lack of time. Really thinking about we're dedicating our time and focus on caring for another human being. So that ability to actually socialize is really impacted. So we oftentimes see increased isolation, and we know that caregiving is associated with worse outcomes, increased chronic health conditions, and increased mortality. So what the evidence shows is that by actually participating in strength training, particularly in a community setting, being able to socialize, we see a significant decline in caregiver burden and caregiver stress. So we see a reduction in caregiver burden. We see a reduction in anxiety and depression. We also see, obviously, improvements in our physical health. But the other thing that we see is the ability to care for our loved one is improved, having less stress, having less frustration. So really, so many wonderful benefits come out of that. And it's not just the strength training component. What it is also that community component, right? Reducing that isolation. So the next area that I want to spend some time in is thinking about and discussing the benefits of strength training on cognition. And so this is my last slide, and then I'll be handing it back over to Eric. So what we know is that strength training is not only beneficial for our physical health, as I've described in the past slide set, but also plays a significant role in our cognitive function, particularly in our older individuals. So, what the research has shown is that regular resistance training positively impacts not only brain structure, but brain function and mental performance. And it does so in several ways. The first one is by enhancing neuroplasticity. What is neuroplasticity? What does that actually mean? This is that what we see is that strength training actually stimulates the release of brain derived neurotrophic factors. What is that? What that is that those BDNFs, or the brain derived neurotrophic factors, actually support neuronal growth. It supports the synaptic plasticity and overall brain health. So that's one of the benefits that I want to talk about. So we're enhancing that neuroplasticity of our brain. We also see improvements in memory and executive function. So studies have shown that resistance training enhances not only working memory, but our ability for attention and problem-solving skills. And this is seen in not only individuals who may have cognitive impairments, but also in individuals who do not. So our healthy older adults who do not have any signs of cognitive impairments. That's really important because, again, not only we can view strength training as preventative, but also as a treatment strategy too. That's going to slow down that progression of the disease. We know that it reduces the risk of cognitive decline and dementia. So we know regular strength training is associated with a lower risk of Alzheimer's disease and other dementias that are likely due to that improved blood flow and the reduction in neuroinflammation. So again, the role of inflammation is so impactful. In any ways we can actually reduce inflammation, we see significant improvements across a number of health conditions. And finally, what we know is that strength training actually increases brain volume. Resistance training has been linked to increased gray and white matter volume. Why is that important? Well, that's important because those regions are involved in memory and decision making. So by being able to increase that, we're actually seeing improvements in that memory and decision making. So extremely exciting evidence and research is coming out around cognition. And again, this is really just some of the start of the work that individuals have really been doing in this very, very important area around exercise, particularly strength training and cognition. So I'm going to hand this over to Eric so he can talk about the impact of exercise and reasons why we don't actually take part in these wonderful benefits.
Hey, this is awesome, Katie. Before we hand it over to Eric, do you mind answering a few questions that have come in related to what you've talked about? So,
yes.
One says, many people now say eat fruits and vegetables and reduce or don't eat protein, especially if you get older. How do you rationalize that not being correct, given your emphasis on the importance of protein?
Yeah, no, this is such a great question. So the way I always want to talk about protein is we need to be thinking about protein in our overall diet, right? We absolutely need to be eating fruits and vegetables. And protein can come into plant-based and animal-based proteins. So that's really key and important. When we are consuming protein from an animal base, what we really want to be thinking about is lean proteins. So proteins that are lower in saturated fat, right? When we're thinking about the impact of protein on health, particularly our red meats, really we're looking at the impact of saturated fat, so increasing our risk for cardiovascular disease. So when we actually choose lean products, that's going to reduce that risk of saturated fat and ultimately reduce the impact of heart health or cardiovascular events. So that's one thing that I want to say. And when we're thinking about dairy, we again want to be thinking about lower fat dairy products. So low fat dairy products are not filled with fillers. No, they're just reducing the amount of actual fat that's in those products. So we can choose our skim or our 1%, reducing saturated fat and still getting the wonderful benefits of protein and not having impacts on heart health.
Okay, well, let me do one more and then we'll turn it over to Eric. But because Serafina's question is, do protein sources matter, plant versus animal? Also, what about protein supplements like Ensure? And do you look at those as that they count? Like a couple of questions in there, but maybe a few thoughts, and then we'll transition back to Eric. And folks, we'll get the rest of the questions. The other thing I wanted to mention, when I went backstage, it said not recording. the event is recording, so don't worry. We've got a recording for this. So anyways, Katie, I gave you a few
Yeah,
seconds there to think about your answer.
I got you. No problem. So the way we oftentimes think about protein is in digestibility and quality. So I just want to cover this really briefly. So we have high quality, moderate or middle quality, and low quality. So high quality proteins are proteins that come from animal sources, or the digestibility of those proteins are very high. Animal proteins have all of the essential amino acids and we digest them at a higher ability. What does that mean? It means that we get more of the essential amino acids. That doesn't mean that animal proteins are better. No. It just means that we're going to be able to hit that 30-gram threshold, or we're going to be able to see that impact of muscle protein synthesis by consuming a little bit less amount. When we move into plant-based proteins, we're going to have to consume a higher amount to get the same benefit, get all of those essential amino acids, meet that 2.5 grams of leucine that's really going to drive that muscle protein synthesis. So I never want to say one is better than the other. It's more about digestibility and also having to be more intentional when we move to plant-based. So we can absolutely get the protein that we need using plant-based proteins. Now, our supplements. Whey protein is going to be the highest digestible protein, that the source of protein that we can have. So we see that we're going to get all the essential amino acids from our whey protein, and the digestibility of that is the highest. We see whey protein in those supplements that you were talking about. So and you can see the marketing of those supplements. They're going to market 30 grams of protein, and that 30 grams of protein is going to be coming from that whey protein. So I always am, I think these are great ways. These are easy sources of ways in which we can hit that 30 grams of protein. So again, it really depends on the individual, your preferences. But again, those products are not bad. Those products are really nice. They're easy to be able to get that very highly digestible protein that can actually help us stimulate muscle protein synthesis.
Okay, we got tons of good questions that are coming in, but let's let Eric share his resource, and then I'll come back and we'll answer any and all questions that come in, folks. So keep them coming in, all right? And we'll see you in a little bit.
And I appreciate it, Steve. And we'll try and be brief because I know there are a lot of questions coming in. And hopefully part of what I'm about to introduce will help address some of those questions, because what Dr. Starr just introduced was all of this wonderful foundational knowledge around A, what happens to our bodies as we age, and B, the fact that there's something we can do about it. And that something happens to be really, really profound and impactful. And yet, with all of the science, and by the way, much of this is not new, we have known how effective exercise, and specifically building strength, how good it is for you for over half a century. Why don't we see more older adults doing this? And the numbers are pretty sobering if we look at them. So 30% of all adults over the age of 65 in this country don't exercise at all. Only 20% meet the CDC guidelines, which are strength training 2 times a week, 150 minutes per week of moderate aerobic conditioning plus balance exercises is necessary. Only 20% of those of us over 65 are hitting that number, and less than 10% of us are engaging in regular, consistent strength training. Those are pretty sobering numbers, and it would be easy to dismiss. And I think it's important not to dismiss that, because clearly there's something going on where we have reasons that we're not doing it. And part of it is, yes, exercise is hard and it's challenging and we don't like to sweat, but I think it's bigger than that. And in a lot of the research that we've done over the years, we have really kind of figured out that there are these very common objections that exist. And even for those of you who are listening right now, you can probably look at this list and think of the things that you think. And much like Dr. Starr showed that picture of Arnold Schwarzenegger earlier, and we kind of have that vision in our mind of what strength training is, I think that reflects on why these reasons exist that we don't think we can do this. And a couple just to point out, I'm in pain, I have aches, doing strength training would make me hurt more. I don't want to bulk up. Thinking, lifting weights is not for you. I've never done it. That's just not something I want to do. I already walk is a really common one that we get a lot. I don't need to do strength training. I'm already walking. And this fear of getting hurt. And at the end of the day, all of these are very, very common. I think they're all completely natural. they're also all misconceptions. And part of why we are doing this presentation is to help people understand that this is something you can do. And it may be counterintuitive, but it is still what is valid. So the whole concept around I'm in pain, I've got knee pain, shoulder pain, I can't do this. Actually, engaging in strength training was one of the single best things you can do for osteoarthritis and relieving pain. Being worried about getting hurt, you're actually more likely to get hurt if you don't exercise and you don't strength train than if you do. That will prevent you from falling. It will prevent you from getting injured in other ways. And so it's really important to kind of think about these misconceptions that we have, that we place in our minds and cause us to not pursue things like this out of fear, out of embarrassment or shame. And it's really important to help think about that you can do this with some caveats, right? One of those caveats is making sure you're being safe. Another is making sure you have the knowledge and foundation to be able to do this on a regular basis and see those impacts. And that's really what I want to talk about next is hopefully this is interesting, this is engaging, this is starting to get you motivated to help kind of think about, taking some steps into bringing this into your life. As you think about that, there are some very important keys to success that I want to help relay. And thinking about if we're building a house, that foundation, that floor, that most fundamental principle of all is in order to see the benefits from exercise and specifically building strength, it has to be done consistently. What does consistently mean from a strength perspective? It needs to be done really at least twice a week, optimally 3 times a week. Not a lot, maybe 30, 45 minutes for each session, but it needs to be consistent. It can't be something that you do occasionally or seldomly. Exercising, engaging in strength training once this week, once next week, then you take 3 weeks off, you do it one more time. You're just not going to see those outcomes. Consistency is that foundational thing that you have to figure out how to incorporate into your own routine. How do you do that? There's a lot of different techniques for how to do that, whether you want to schedule it in your calendar, whether you want to include other people, friends and family, using a trainer, maybe spending money towards that, which helps, make sure that you do that accountability. But consistency is really, really important. It is that foundation and doing it 2 to 3 times a week. I don't like to deliver this message, but it is also the truth. Exercise is not something you can do for 8 weeks and check a box and never do it again. This is something you need to build into the DNA of your lifestyle so that this is something you're doing every week on a consistent basis. Just above consistency, it's got to be a little bit challenging. We don't want it to be really challenging. Really challenging will result in injury. We also don't want to be too easy. And I think for a lot of us, we are fearful that we're going to get hurt. And so we default to too easy. It's got to be a little bit challenging to be able to get those wonderful benefits that Dr. Starr talked about. What does a little bit challenging mean? If you're doing a series of repetitions of an exercise, maybe arm curls as an example, really looking for 8 to 12 repetitions where those last couple of repetitions are a little bit challenging, right? Maybe you're grunting, maybe you're breathing heavy, maybe you start perspiring a little bit. If you are just doing them over and over again, you crank out 100 repetitions of arm curls and you're smiling and not sweating at all, it's not challenging enough. So a good rule of thumb is about 8 to 12 where those last couple are a little bit challenging. That's the sweet spot for getting that level of challenge where you will see those outcomes. Just above that level of challenge and kind of helping reinforce that level of challenge is thinking about variety. The human body is wonderful at adapting to surroundings, to the environment. The same is true with exercise. If you do the same things over and over and over again, your body will adapt. What we want to do is create that confusion, create that level of challenge, and bringing in variation is a wonderful way to do that. So thinking about mixing up the types of exercises, the way you're putting this routine together, switching from not just walking when you're doing aerobic conditioning, but maybe walking and biking or cycling, or swimming, or walking fast or walking slow, really thinking about changing it up. And then we probably don't need to belabor the point, but really making sure you're hitting that target of 30 grams of protein at every meal as much as you possibly can. If you do these things, this is what is possible. This is what the scientific literature shows. This is what we see in our own research when we're running this Vivo program that we run, which is after about 2 months of twice a week strength training, this is the averages that we see, roughly about a 25% increase in strength and endurance. Imagine being 25% stronger than you are now in 2 months. It's a big deal, right? It impacts so many aspects of your life. As Dr. Starr mentioned, people sleep better. You feel more confident. Your mood improves. Your blood pressure drops. All these wonderful side effects. And it's twice a week for 2 months. You'll see some pretty significant results. So it's really a lot of scientific literature that backs everything that we're talking about. In addition to those kind of elements that you need to bring in, we also wanted to reinforce some things that are really, really important to think about, that if you're going to incorporate this in your own lives, make sure you're thinking about these 4 things because it will determine ultimately your success. We know we want to do it consistently, but on the side, if we're not safe, if we're not really focused on safety, then we will get hurt and it will impact your ability to do this consistently. How do we engage and exercise safely? Well, one way is work with a professional, whether it's a physical therapist or a certified personal trainer or an exercise instructor, an exercise physiologist. Seek help. If you have a really strong foundation in exercise, maybe you feel competent to be able to do this on your own. It's always a good idea to bring in, at least in the very beginning, someone else who can watch you, make sure your form is good, make sure that you're doing things to that appropriate level of challenge and not too hard, not too easy. Really thinking about safety as being that really fundamental thing that really drives, because if you do get hurt, that's the worst possible scenario, right? So safety's got to be of the utmost importance. Right above safety is if it's not fun, you're not going to do it. And we talked about how important consistency is. At some point, if you're not enjoying yourself, you're going to stop. And we don't want that, right? We know consistency is the most important thing. So look for ways to make exercise fun. How do we make exercise fun? I think it's different for everybody, but there's probably some common things. For some of us, it's doing it with our friends or our family. That helps make it fun. Maybe we're listening to music while we're exercising. Maybe we're watching a movie. Maybe we're outside and being in nature. All of these are just examples of how to make it fun. Thinking about this for yourself and what makes it fun for you, and then experiment, right? Do different things and figure out what you enjoy, and then do more of those things that you enjoy. And don't forget to bring in that splash of variety, right? We talked about this concept of variation, making sure we're continuously challenging and switching things up. It's another part of this. And last but not least is really creating a system of accountability for yourself. We talked about this a little bit, and just to reinforce a couple of key concepts, and then we'll wrap up and answer some more questions. How do you create accountability for yourself? A couple of techniques that I do that may be helpful. I schedule this in my calendar, and I actually build a routine. So I know I'm strength training Tuesdays and Thursdays at noon. That is my time to strength train. And because I do it at the same times and the same days every single week, it's a part of my routine, and it helps me stay accountable. What's another way to increase accountability? For me, I actually use a trainer that is waiting for me and I'm paying money for. So when you make a monetary investment, when you have someone else that's waiting for you, that's an appointment. It helps you with that accountability. Even if I'm tired or I don't feel like exercising that day, I know that trainer is there. And so I know that's a reason to help do it. Another great way of accountability along the same lines is doing this with friends and family, like we talked about. Not only does that possibly make it more fun, but when, again, there's people who expect you to be there, you're going to be that much more inclined to show up. And the last thing around accountability is this concept that I want to share called a kedge. There's a wonderful book called Younger Next Year, which was really this foundational document that helped me create this company called Vivo, that we are really focusing on building strength in older adults. And this concept of kedge is an old nautic term from, centuries ago when sailing was the primary mode of transportation. And sometimes the wind would die down and the boat wasn't moving. And what they would do is they would drop an anchor far away, and everyone in that boat would pull on the anchor line to start the boat moving. And it was this really hard, arduous task, which was called kedging. Well, they took that principle and said, find something that is a big, audacious goal for yourself, like your kedge, your big, challenging goal to help keep you motivated and come up with one thing every single year that you work towards. And for everyone, it's going to be different. Maybe you used to be a runner and you want to be able to run a mile or a 5K or a 10K. Maybe you love travel and you want to be able to travel independently and put your suitcase in the overhead bin in the airplane, or be able to climb the steps of the Coliseum. Or maybe you just want to be able to comfortably get onto the floor and play with your grandkids and know that you can get off of the floor. But really setting that big challenging goal that is your North Star, that helps with your accountability, it helps with that motivation. These are really wonderful techniques that do one big thing a year that will help drive you towards adopting exercise and specifically focusing on building strength. With that, we certainly are happy to answer more questions. If you have questions after this is my contact information. You can certainly feel free to reach out. But we have about 10 minutes and are happy to answer some more questions, Steve.
Yeah, all right. That was great, y'all. And we do have a bunch of questions here. And then after we get through these, the RAZ team is going to come on. We did this last time with them, where if you're a RAZ user and you got questions, or if you're not a RAZ user and you're curious about that, they'll come on and do sort of a free form Q&A. So stick around if you're interested in that. But let's get to some of these questions. Okay, Suman asks, is it healthier to be a vegetarian and eat no meat, or be a meat eater? Can you make a statement on that one? Is it healthier?
I think you can be healthy doing both. I really do. I think you can absolutely be healthy being a vegetarian. You can absolutely be healthy eating meat. It really depends on the options that you're making. So again, when we choose leaner meats, those are healthy options. When we choose chicken, those are really healthy options, and so it's not going to have a detrimental impact. Again, we think about our diet as it's not just about the protein source, right? We have carbohydrates, we have fats. So we have to be thinking about, are we consuming adequate fruits and vegetables? Are we eating the rainbow, getting in all of our antioxidants, phytochemicals? Are we getting in whole grains? Are we getting in our adequate fiber? So it's not just, I'm going to be a vegetarian or I'm going to be a meat eater. It's really thinking about that whole picture and the choices that we're making. I have vegetarians who eat very poorly, who don't eat any meat, but also eat a lot of refined grains and eat very few, variety of vegetables. So again, like it really does. There are definitely ways where we can be extremely healthy doing both of those. So it's not a either or. It's an and with.
All right. I got a couple of good exercise questions here. Larry says, is there a more beneficial time of day for optimizing your strength training?
Oh, there's a lot of research that's happening right now around this, and I will share. There's not really here's the conclusive answer, and this sounds wishy-washy in the same way that kind of we were just talking about of plant-based versus animal-based. It's whatever keeps you motivated and accountable to doing it is the answer, and that's not meant to be dismissive of the question. There is not clear science. I've certainly a lot of what I've read recently. There's a lot of research on people doing this in the morning, especially when they're fasted. We don't know enough yet. And really the answer, and I mean this with all true honesty, is what works for you is the best. So if you are a morning person and that helps motivate you to stay with it, exercise in the mornings. If you are an evening person, make this a part of your routine at night or in the evening. I will say that exercising before bed is maybe not the best idea because it will increase your blood flow. It will increase your stimulation, and you'll have probably a little bit of a harder time falling asleep. So
we heard sleep is very important to our health. Yeah.
that's right.
Okay, Richard says, and Richard, this is awesome. He says, I'm 87. What limitations or cautions, if any, should I observe? And before you answer this question, I just want to remind everybody that age is just a number. And Richard, the fact that you're here asking that question leads me to believe that you probably fall into the category of age is just a number. But what in general, whether we're 87 or 67, what should we be cautious about?
I'll share a couple of thoughts and then Dr. Starr, welcome your ideas too. First and foremost, I think you should consult a physician. Everybody should before starting this. We all have a great variety of different, pre-existing conditions that we're all dealing with, whether it's cardiovascular disease or type 2 diabetes or osteoporosis. They all bring unique special considerations as it relates to exercise. So someone who knows you and knows your health history, it's an important first conversation to have. Beyond that, there really are no, the limitations are listening to your body. There's a wonderful quote that I heard once that I'll share with everyone. It is, if you listen when your body whispers, it doesn't need to scream.
Yeah,
Think,
and
think
none of
about
us like
that.
when it screams.
Right. And there's this, we all grew up with this notion of no pain, no gain. That could not be more opposite, right? If something hurts, don't do it. And so part of this is understanding, and this is where I always recommend at least starting with a professional, right, who can guide you through those first steps of understanding what does it feel like to do a chair stand or a squat or some of the most fundamental movements that mimic activities of daily living. That's where you want to start. And there is no age limit. There is no too old. We can all benefit from this, but starting with a professional who knows about your individual conditions is important.
And one really cool thing, when I attended the Vivo class this morning, there was one of the participants had some issues, and the trainer knew that. And so, like when we were doing our exercises, he said, "Hey, Joe, for this, here's an alternative exercise because I don't want you to raise your arms." So having an advocate and whether it be a trainer, coach, doctor, or what have you. Um, Okay, we got some protein talk here. That's always this one's probably for you, Dr. Starr. But okay, there are so many different whey proteins and collagen. How do we decide which one to use?
Yeah, no, this is a great question. And this is a question I get a lot regarding collagen. So I just want to, and I think there are a few other questions about collagen. So collagen is extremely beneficial. So I just want to state that it's really shown significant benefits for injury recovery, joint health, skin benefits. Collagen does not have all of the essential amino acids, and so it is not considered a complete protein. So we typically, it doesn't, it's lacking that leucine, the driver to stimulate muscle protein synthesis. So when we talk about foods, about protein sources that are really going to maximize building protein, collagen is not the first source that I would be going to. I'm going to be thinking about our whey, our casein, our plant-based proteins that have all of the essential amino acids. So those are going to really include, for your plant-based proteins, your soy protein, your tofu, your tempeh, your edamame, your quinoa, your hemp seed, your chia seed, your buckwheat. Those have all 9 of the essential amino acids and are considered a complete plant-based protein. And then what we can do is actually combine proteins like legumes and grains. When we combine those, we get all of the 9 essential amino acids. Nuts and seeds with legumes. Again, anything that's missing in the nuts and seeds are replaced with legumes to give us all of the essential amino acids. So hopefully that helps explain when we think about the differences in protein. Collagen is beneficial, but it's not what's going to help us build muscle mass.
Okay. All right. Got lots of good questions here, folks. Let's we'll try to get through as many as we can. But I'm glad Kitty asked this question. Strength training advice for someone with dementia. Today when I was on your Vivo platform, I mean, who knows? I mean, there could have been somebody in my class that had dementia, but tell us a little bit about that strategies that we might use there.
So this is a really it's always one of the more complicated questions, and there's a wide spectrum of cognitive decline and dementia that exists in every individual. And at the end of the day, Vivo is a follow along program. And so there may come a time where an individual, this is not the right program for them. And a caregiver being present certainly extends that amount of time. So participating with a caregiver or a caregiver that can help provide that additional assistance is a great way to ensure that there is that participation, that there is that comprehension of how to progress with of any exercise program, but certainly with what we're doing with Vivo. That being said, again, safety is that fundamental right principle that we want to make sure people are safe. So there does generally come a time on this kind of spectrum of dementia where participating in a follow-along exercise program, specifically like Vivo, might not be the best idea, and getting a much more individualized approach is the right path. So not to, it's a moving target for everybody. Certainly the presence of a caregiver can help ensure the success of that process.
So
Yeah, and just really quickly, what the research shows is using that dyad of both the caregiver, the care partner with the care recipient exercising together, we see those similar benefits of it's kind of this wonderful coalescing of benefits of helping your care partner, but also getting the physical and the mental benefits of working out together. So there is a lot of research in that area to being able to work together.
and I'm going to put in a big shout out for Sam Simon, who is the actor and playwright who wrote the play Dementia Man, and he performs it. He has dementia, and he performs it. I'm dropping into chat this, but what he's advocating for is that there's a, a that people have cognitive navigators, that when you have any kind of cognitive impairment, there is someone who's your cognitive navigator that's there to help you, guide you along the way, whether you're going to a restaurant or you're exercising or what have you. And so, Eric, your comment about a caregiver, a family member, can be a great solution to help somebody with dementia exercise. All right. Okay. What protein is good for someone with kidney disease? I'm always told to consume less protein.
Yeah, so this is a great question. And it really does depend on the stage of kidney disease in which you're at. When we're at stage 4, which is almost at end stage kidney disease, that is where we actually start to want to limit our protein intake. But before we get to that, so if you have chronic kidney disease stage 3 or stage even 4A, we need protein. We still need that protein to function properly to maintain that muscle mass. And so that can include both plant-based proteins, animal-based proteins. Now, kidney disease is very complex and challenging. So once we get to stage 4B and end stage, things start to shift. When we actually get to end stage kidney disease, our protein needs go up significantly because we are on dialysis. So that's why it's a really complex condition, and really want to work with a registered dietitian if you have chronic kidney disease, so that you can really get the specialized care that you need around that area.
All right. I see, Eric, that you've got to head to another event. It's been great having you on here, and we'll share your contact information on the recording link and all that. Dr. Starr, can you hang out for just a little bit?
Yeah, absolutely.
And I'll try to do a couple more questions, and then we'll bring the RAZ team up. I like Cheryl's because I can relate to it. Cheryl says, my problem is I lack the urge to eat 3 meals, but I eat at least 2, and I really don't snack. So any suggestions for me there? And I do 30 minutes of exercise a day just to be able to move. I think there's probably a lot of people out there, myself included, Cheryl, that can identify with your what you shared. But Dr. Katie, any suggestions?
Yeah, no, absolutely. And Cheryl, this is so common. Most of us are not eating 3 meals a day. It's actually really hard to eat 3 meals a day, especially if you haven't. What I always tell people is, depending on where you're eating, and a lot of times I hear that people skip breakfast. That's the meal that I would just try to start small. Again, this could be just one of those very quick supplement drinks. If you wanted to try that, a little bit of a 30-gram protein drink or a Fairlife milk drink. Those products are available, and it's easy. We're typically drinking anyways, so that's another just easy way to get in a little bit more protein. And that's where I usually start with my clients, is around breakfast. We start small. If you haven't eaten a meal, if you haven't eaten 3 meals a day, I don't expect someone to have this massive breakfast, right? Start small, try to incorporate it. And again, the goal is just to try to maximize the protein more consistently throughout the day. If you get 2, that's better than 1. And again, let's think about the wins here as well.
Okay. Okay. This is great. Let me do. I'm gonna get a quick one here. I like this one. Leah says, "What advice would you give to parents who walk 2 active dogs for their main form of exercise?" Number one, I think walking dogs is the best form of exercise around. But Katie, anything that they might give
Yeah,
to their parents?
absolutely. So most of our parents haven't done strength training in their entire lives. And so strength training is just foreign, or resistance training is very foreign to them. So the place that I often start is really kind of going back to our physical activity guidelines and recommendations, and also kind of tying back, why is strength training important? Strength training is important so we can actually build muscle. Our cardiovascular exercises are not going to maximize muscle gain and really slow down sarcopenia as well as resistance training. And so that's something I like to always emphasize. Like, if we can, is it possible we could just add 1 day of resistance training in and just see how we feel? So that's where I like to start. Again, start small. Coming back to the question about our individuals who's 87. In geriatrics, we have a saying, it's start slow and go low. And what I mean by that is, when you're starting something new, we don't need to do something full out, right? Let's get used to it. And so again, one of the things I do love about Vivo is we have a level system. We have a level 1 exercise, level 2 exercise, level 3 exercise, and a level 4 exercise. For each of the exercises that we do, level 1 is chair-based. So when I have somebody who's coming into a new exercise program, I want them actually I want to go on the lower end of this so that they can get used to the movement patterns. They can get used to the program itself. And then as we build more confidence, we can then start to see where we're at. What exercise level should I be using based on how comfortable I feel, based on, do I have pain that day? So again, kind of going along with this as well, with our parents, start slow, and go low. Let's just try 1 day.
I like it. Man, Dr. Starr, thanks so much. And as I said at the beginning, I'm super impressed with your platform. I see the value in it big time. And folks, if you didn't get the links to the free trial, there's a little resources button at the bottom of your screen. You can click on that. But at the recording link at proaging.com, we'll also make sure to add that link in there. This really been helpful. And if you want to hang out, you can. But folks, we're going to transition to now answering any questions that folks might have about the RAZ Mobility phone. This was a lively discussion the last time we did it. You had a lot of people on the call that were RAZ Mobility users, Nerman, who were had some questions. So folks, just use chat, use Q&A, and we'll see if we've got any calls on that. Okay, we'll see you, Dr. Starr. Thanks so much.
Thanks, Katie. Indeed, and we received this time some excellent questions as well. I will start with a question related to our newest feature that was recently released. And I'm sure that some of the caregivers on this call who have parents with dementia have faced that challenge. And we are talking about repetitive calls, correct? So a user with dementia, they might be placing calls to the same phone number over and over, unaware that they just recently have talked to someone. And we are trying to assist caregivers as well as the dementia phone users by introducing a feature allowing the caregiver to set rules to limit such repetitive calls. So basically, the approach is very straightforward. The caregiver can say that there should be no more than 5 calls to one and the same phone number, let's say over a period of 2 hours. So once that threshold has been reached and the senior is trying to place another call, they will hear an announcement that at this time the call cannot be completed and that they should try again later. And this recording is, there is an option to select the default audio recording. It's a suggested audio recording created by RAZ, an announcement, or every caregiver, they can create their own custom recording, which we strongly recommend, because if the senior is hearing an announcement in the voice from someone they know, such as their child, or someone else from the family, their reaction will be significantly more positive. So the feature has been rolled out. It is also available to all existing customers as a free upgrade of their software. They can easily reach out to our customer support, and they will be glad to assist them to upgrade the phone to the newest version.
Great.
So it's actually a set of questions. So I'm trying here, in the interest of time, to combine some of the questions and provide answer that will cover multiple questions. And it was actually about new features, what is ahead, and in particular we have two features that are very, very popular, and one of them is text messaging. So the question was, when will text messaging become available for the RAS Memory cell phone? And we expect this feature to be rolled out soon. We have been working very hard on it, and it will be really a very, very specific and great experience, offering many options for caregivers how to tailor the text messaging feature to the needs and capabilities of the senior. Just to mention one feature that is very familiar to all memory phone customers, where they can limit inbound calls, let's say only to contacts, to known phone numbers, and that will be available for text messaging as well. So they can really have a great spam and fraud protection. The other question was about photos, correct? So can caregivers or contacts share photos with the senior on their memory phone? The answer is not at the moment, but it's coming very soon. So not only that caregivers will be able to share photos with the senior, but they will be able to create a whole photo album for the senior and to manage that photo album that will be available to the senior. And as always, all the features and all the options are being managed through the RAZ Care app from the caregiver's phone, and all of that is done remotely. I think we had a question. We had a very, very interesting topic, and we have here a question. What can we do to make it even harder to prevent emergency calls? We did roll out several releases back. We did roll out the additional options, actually, two additional options, how to position the emergency calling button, including that it can be even removed and then either created as one of the contacts, or in the case where the senior is using the dial pad, then the 911 calling would be available only through the dial pad. And an additional option that I would strongly recommend is also our RAZ emergency service. You can find more information about it on our website, where emergency calls are actually being handled by a private concierge service. And we are trying to determine through that process if it is a true emergency and if emergency services need to be involved or not. So I think we ran over for some 15 minutes today, and I would like to turn over back to Steve at this time.
Wow, this was great. I mean, it was a fantastic program. We had some great questions and discussion. I'm glad that we got to answer a few of the RAZ mobility phone questions as well. And I'm really looking forward to the next speaker that you come up for us on one of these discussions. This is a lot of fun. I really enjoy partnering with you.
Thanks, Steve. Thanks, Steve, and stay tuned. We are, very excited about our next webinar, and we are preparing some nice surprises down the line.
I love it. All right, folks. Well, this has been a great one, and we will get the recording up at proaging.com along with a bunch of links and everything. Thanks a lot, and we will be talking.